Hi, my name is Sophia, and today I'm going to be presenting on psoriasis. So psoriasis is a chronic autoimmune condition that causes overproduction of skin cells and skin inflammation. So like I said before, psoriasis is an inflammatory skin disease mediated by both cells of the innate and adaptive immune system. Specifically, it's a T cell mediated disease, and the main initiation pathway involves a plasmacytoid dendritic cell, or plasmacytoid dendritic cells becoming activated by a TLR7 agonist, and then they produce interferons. And then I have a picture with a cross section of non-lesional, so like healthy skin, and then a picture of skin with psoriasis, the epidermis and the dermis, and then below you can see like the T cells, the number of T cells in non-lesional versus lesional skin. So the summary of the initiation of psoriasis is basically there's a trigger to the skin barrier. Usually it's like a trauma, it's like a cut or a sunburn, some sort of infection, and then there can even be the trigger can even be something like emotional stress. And this activates the dendritic cells, and these dendritic cells then produce IL-23, leading to Th17 and Th1 activation. And the Th17 cells secrete IL-17 and IL-22, which leads to keratinocyte proliferation and inflammation in the skin. And then the keratinocytes release chemokines, basically that recruits like more immune cells, perpetuating the cycle of psoriasis. And then there's a picture of, or yeah, a diagram of kind of that whole cycle, with like more detail. So there's five different types of psoriasis. Plaque psoriasis is going to be the most common type. And this kind of is just like red scaly or raised red scaly patches on the skin. Usually they're pretty symmetrical, on both sides of the bodies, and they're going to be found like in people's scalp, trunk, and limbs, specifically around the elbows, um, and the knees. Next is going to be guttate psoriasis. So these are small red dots that are just going to be found on mostly the limbs and the torso. And this one's like mostly going to be found in children and young adults. And typically it's triggered by an upper respiratory tract infection, such as like strep throat. Next is going to be pustular psoriasis. So just like it kind of sounds like in the name, these are just like little pustules surrounded by red skin, that mostly appear around the hands and the feet. And this type of psoriasis is going to be mostly triggered by medications, and infections, and sometimes stress. And there's a few chemicals. I forget exactly what chemicals, but they also trigger pustular psoriasis. And there's inverse psoriasis, which is basically the opposite of plaque psoriasis. So it's like smooth red patches that are going to be found like in skin folds. And it's really not that common. And then erythrodermic psoriasis is going to be the most severe type of psoriasis. So it's going to be red, like the red scaly skin, just like in plaque psoriasis, but it's going to cover most of the body. And this is mostly found in people who previously were diagnosed with like a different type of psoriasis. And it's triggered usually by a really bad sunburn or a specific medication. Um, and yeah, it's really severe and it's really serious. Yeah. And then on the bottom, you can kind of see the hallmark of each type of psoriasis in a picture. Um, so, so other symptoms of psoriasis are basically like the dry, cracked skin that's going to itch or bleed. Those are called like the plaques. Another really common symptom is you're gonna see changes to the nail and like the nail bed. They're gonna be like your nails can become like really thick, rigid. And a lot of people with psoriasis, especially severe psoriasis, experience poor sleep quality. And then, an, not a side effect. Yeah, a side effect of psoriasis is basically joint pain, stiffness, and swelling. This is called psoriatic arthritis. I'll talk more about that later. And then psoriasis is going to affect like pretty much all areas of the body, or it can affect all areas of the body, but it's going to mainly affect people's elbows, knees, face, inside of the mouth, scalp, genitals, lower back, palms, and feet. So prevalence, so psoriasis is not super rare. It affects like 3% of the adult population in the US and 2 to 3% of the world population. But I think it's important to note that a lot of people are living with undiagnosed psoriasis. The approximation is 600,000 adults in the US. And the prevalence of psoriasis is pretty similar between males and females. I think in males it was like 2 or it was 3.2%, and in females it's 2.8% in the US. Um, and then the white population is going to see the highest prevalence of diagnosed psoriasis, but it's actually thought that the number of people with psoriasis is pretty similar across all racial groups. But the disparity in the numbers has to do with like access to care or just like general health disparities between racial groups. And then individuals ages 50 to 59 experience the highest prevalence of psoriasis, and ages 20 to 29 experience the lowest prevalence of psoriasis. But anyone can be diagnosed. Like it's not uncommon to see somebody in their teens or 20s, 30s to get diagnosed with psoriasis. So complication of psoriasis, like I mentioned before, psoriatic arthritis is is of psoriasis, and it's going to like affect 1 in 3 people. And this is basically just inflammation to the joints. It's going to cause pain, stiffness, and swelling. Um, and this usually happens to people who were diagnosed with psoriasis when they were younger, and then when they get into their 50s and 60s, they develop psoriatic arthritis as a result of living with the condition for such a long period of time. And people with psoriasis may also be at a higher risk of diabetes, obesity, high cholesterol, strokes, and a heart attack. So causes and risk factors of psoriasis. So streptococcal and HIV infections are thought to be a risk factor or cause of the condition. Also, drugs used for treating heart disease, malaria, and mental health have also thought to be like a trigger for psoriasis. Smoking and alcohol consumption are not going to like trigger psoriasis, but they can increase symptoms and risk of flare-ups. Yeah, also psoriasis like is a condition that you'll kind of see improvement and then worsening like over time. So you'll see like periods of improvement. Maybe you'll even have like no plaques on your skin. And then you can experience something called like a flare-ups where you develop the red patches and you have to kind of treat them again. Um, and another risk factor is going to be obesity, and then family history is going to be the main one. There's a strong link to genetics. Um, and then injury to skin, such as cuts, scrapes, bug bites, and severe sunburns, are also thought to trigger psoriasis as well. So diagnosis, um, psoriasis is like pretty easy to diagnose. Dermatologists will usually diagnose a person with psoriasis through like visual examination of skin, scalp, and nails. And the dermatologist will like review your symptoms with you. And sometimes if it's kind of hard to tell if it's psoriasis, such as like if it looks similar to like eczema or another skin condition, the dermatologist will perform a biopsy and like look at the skin sample under a microscope to rule out other disorders. So treatments of psoriasis, topical therapy is going to be the main one, and all of these treatments, basically the aim is to stop the skin cell growth and remove like the plaques and scales because there's no cure to psoriasis. So topical therapy is going to be that first course of treatment to treat mild to moderate psoriasis. So those are going to include corticosteroids, vitamin D analogs, retinoids, salicylic acid, and coal tar. And there's a list, I think the list was like 20, there were 20 different topical therapies. Um, so yeah, there's a lot of different options. So usually like a dermatologist will try to treat you with a topical treatment before they move on to other methods. But corticosteroids are the most frequently prescribed topical therapy for psoriasis. But they have a severe side effect that can cause like skin thinning over time, and also they stop working after a certain period of time using them. The next course of treatment that a dermatologist will try is light therapy. A dermatologist might tell you to get more sunlight. And then there's also artificial light sources and light treatments that are kind of being used more now. Um, UV broadband and UV narrowband are really popular and effective in people with more severe psoriasis and people who like the topical therapies aren't working for them anymore. And then there's oral injected medications for psoriasis as well. And this is like a last resort because they have like severe side effects such as liver and kidney damage. And they can also cause birth defects if you get pregnant or are pregnant. They also have been linked to high blood pressure and malignancies as well. So those are going to be medications such as steroids, retinoids, biologics, methotrexate. And then I also wanted to mention that there is alternative medicine to kind of help with psoriasis symptoms, such as aloe extract, fish oil, and Oregon grape. These things are thought to like improve plaque psoriasis if you apply them to the skin or the affected skin. Yeah, that's it. Thank you.